Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. NIK NIKAM, a cardiologist from Houston, Texas. The feature presentation is cardiac circulation made easy. First, we are going to look at the anatomy of the heart. Then, we're going to look at the circulation. We're going to look at pressures in various chambers of the heart. And finally, conclude with the oxygen saturations in various chambers of the heart. Just to give you a quick overview, you can follow my arrow here, a quick overview of the anatomy of the heart. We have the superior vena cava and the inferior vena cava, which drain blood into the right atrium, which is a thinner wall chamber, upper chamber, compared to a thicker wall ventricles, namely the right and the left ventricles. We have the tricuspid valve here. The blood flows from the atrium into the right ventricle. We have the pulmonic valve and the pulmonary artery, which divides into the right and the left pulmonary branches, which carry the impure blood coming from the right side of the heart into the lungs. And in the lungs, the blood is oxygenated. The oxygenated pure blood comes into the left atrium through the pulmonary veins here. Even though it is shown purple, it has the highest saturation of oxygen in the body. So this is coming into the left atrium. We have the mitral valve here. We have the left ventricle, which is the thickest chamber and the main pumping chamber of the heart. That pumps blood into the aorta. The aorta and the left ventricle are separated by the aortic valve. And of course, the aorta has major branches which supply the head and neck, and the descending aorta also supplies the lower part of the body, the abdomen and the extremities. So that is the anatomy of the heart. Let us move on to the next topic, and that is how blood circulates in the heart. The impure blood from the head and neck is draining into the superior vena cava, which empties into the right atrium. All the blood from the lower extremities, from the abdomen and from the trunk come through the inferior vena cava and empty into the right atrium. When the right atrium contracts, when there is mechanical contraction of the right ventricle, the blood is pumped through the tricuspid valve into the right ventricle. As the right ventricular pressure increases, the blood is pumped into the pulmonary artery. When the right ventricular pressure exceeds that of the pulmonary artery, the pulmonic valves open and the blood rushes into the pulmonary arteries. From there, they are distributed to both sides of the lungs, where the deoxygenated blood is purified, or I should say oxygenated, and carbon dioxide is removed from the blood. So the pure blood comes into the left atrium through the pulmonary veins. There are 4 pulmonary veins, 2 on the left side and 2 on the right side. When the left atrium contracts, the tricuspid valve opens and the blood is pumped into the left ventricle. And as the left ventricle begins to contract, the pressure in the left ventricle increases, which opens the aortic valve, and the blood is pushed into the main aorta. From there, it is distributed to the rest of the body for oxygenation and removal of carbon dioxide. At the peripheral level, when the blood goes through the arteries, arterioles, capillaries, the blood oxygen is removed for the tissues, and carbon dioxide from the tissues is mixed with the blood, so the impure blood reaches the right side of the heart again. So that is a circulation in a capsule. It is a closed system, so there is no chance of blood leaking or crisscrossing chambers, which we may see sometimes in patients with, for example, atrial septal defect or ventricular septal defect. Now let's change our attention to the hemodynamics. In order for blood to move from one chamber to another, there has to be a pressure difference. It is the pressure difference that makes the blood move from one point to another. So the pressure on the right side of the heart are relatively low compared to the left side of the heart, which is the main pumping chamber of the heart. For example, the right atrial pressure is ranging anywhere from 2 to 5 millimeters of mercury. The right ventricular pressure is about 20/5 to 10 millimeters of mercury. The maximum may be 25 millimeters of mercury in the right atrium. Similarly, the pulmonary artery pressure systolic corresponds to the right ventricular systolic pressure, and the pulmonary diastolic pressure could be anywhere from 8 up to 12 to 14. On the left side, we have the left atrium where the pressure is slightly higher, like 6 to 8 millimeters of mercury compared to like 2 to 4 millimeters in the right atrium. The left ventricle, which is the main pumping chamber, has normally like 120/8 millimeters of mercury pressure. The systolic is 120 millimeters of mercury, and the diastolic is 8 to 10 or 12 millimeters of mercury. As you can see, the pressure on the left side is almost 6 to 7 times greater than the right side. And when this is pumped into the aorta has the same pressure as the left ventricle. I'm talking about the systolic pressure, and of course the aortic diastolic pressure represents the diastolic blood pressure. So what we actually measure is the blood pressure, which is a reflection of the pressure in the main aorta, namely 120/80 millimeters of mercury, which translates into 120 millimeters systolic over 80 millimeters diastolic blood pressure. Now let's look at the oxygen saturation in various chambers of the heart. As I mentioned to you, the deoxygenated blood, along with high levels of carbon dioxide, comes to the right side of the heart, and from there it reaches the lungs where it is oxygenated and then pumped into the rest of the body for supplying oxygen and for removing the carbon dioxide. The oxygen saturation coming from the superior vena cava that drains the blood from the head and neck is the one which has the lowest saturation. It could be close to like 60-65% saturation, oxygen saturation. And from the lower extremities, it is close to like 70. Overall, it is 70 to 85% saturation. Oxygen, that's the amount of oxygen. So when the blood circulates in the body, it doesn't mean it's removing all the oxygen in the blood. When the oxygen level is like 95% on the left side of the heart, the blood saturation is between 70 and 80, so it's removing only about like 15 to 20% of the oxygen from the blood. Anyway, so the oxygen saturation could be like 70 to 80% here, and the same number here, and the same number in the pulmonary artery. Because it's a closed system, you're going to see the same thing unless you have a shunt like a atrial septal defect. When an oxygenated blood with 95% saturation crosses to the right side, that increases the saturation in the right atrium, right ventricle, and that's how we detect the presence of shunts in the cardiac, between the cardiac chambers. Once the blood is oxygenated in the lungs, the saturation of the oxygen, blood oxygen saturation is close to 95% in the left atrium. And then it comes into the left ventricle. So the blood leaving the left ventricle is close to 95% saturated. If the oxygen level is low, that's an indication that there may be a problem associated with the lungs not being able to exchange oxygen very well. It could be related to any number of conditions. So this is a quick overview of cardiac anatomy, cardiac hemodynamics, cardiac pressures, cardiac saturations in the cardiac chambers. We have numerous videos on cardiovascular education. Please do watch them, and please do subscribe to our YouTube channel. I will see you in the next presentation. Thank you so much.